Many nurses have entered their field out of calling, but many of them are walking away from the job they once loved because they feel exhausted, they feel unsafe, and that the work is unsustainable. Today, I want to share some of the stories, these real stories that are going around, and to show what's basically happening and things you may not hear about in the headlines.
I don't think any human being should be a nurse anymore.
This is how many of you guys feel. Many of you guys feel just like how she feels. And it's brutal. I've spoken to even some of you who've told me straight up that you're burnt out, you're exhausted, you're tired of working for other people. I know this, I know. Because I've spoken to over 400 of you. It's the same story over and over. The most frustrating thing is that there are people that have been watching this channel for multiple years, maybe 2 or 3 years now, but they're still stuck in the same thing, in the same grind, and they don't know how to get out. But if you're still discovering my channel now, if you're discovering my channel right now, then, all good. It's not too late. There's a way out, but it's not quitting nursing completely. You went to school for nursing, you were excited. Just imagine when you were younger, you probably had less stuff than you have now. You probably didn't have a fancy apartment like you probably have right now. You probably didn't have the house that you have right now or the mortgage that you have right now. And you probably didn't have a fancy car. The car that you had at the time was probably like a lemon, a hoopty. But now you're driving a Benz or something, one of these like luxury Hyundais. By the way, like these Hyundais and Hondas, they're really nice. When I was in my 20s, a Honda was not at the same level as a Benz. But now there are Hondas that are nice out there, and nurses love driving those really nice luxury cars. But you didn't have that. But now you have it. You have all these liabilities. This is why you're slaving away at this job. You think these hospitals care about you like that? They don't.
The way we get treated, it should never happen anymore. Patients are so disrespectful. Every time you see someone for the first time, a patient, it's a complaint, this, after this, after this. This drags your soul down.
Yes, it'll drag your soul down. Let me start with the hospitals first. Do you realize that most of these hospitals are owned by what is called a private equity? A private equity is just a company that is faceless. You don't know who the owner is. And it'll buy up the hospital that you're working at right now. So they can treat you less than a human being. Because you're just a number on a spreadsheet. Every single year, the board directors of that private equity, they'll sit down and say, this is our budget that we're going to pay these employees. And we have 100 employees, we have 100 caregivers, we have 100 nurses. And you're one of those 100 or thousands, whatever. And then they'll allocate a salary amount to you and say, this is the most amount of money we can afford to pay her. But we're going to continue to pile on, pay him or her. But we're going to continue to pile on as many patients as we can so we can make those fat profits and announce to Wall Street that, hey, we've made record profits at your expense, at your sweat, while you're slaving away. They don't care about you like that. You're playing a rigged game. This is why this lady and many of you are frustrated. But you're complaining to somebody who doesn't care, because you're complaining to an LLC, a private equity company. You're not complaining to anybody. Nobody cares. Nobody cares. Nobody cares. But I do. That's why I'm giving you all this game. If you want to get out of this mess, you need to take charge of your life. And the only way to take charge of your life is to think differently. I'm glad at least she's voicing out her frustrations and everything. But a lot of you All you do is complain all day. Who are you complaining to? Who? If you work for a big hospital or big like care facility, have you ever met the owner? Have you ever asked yourself who the owner is? Do you even know who the owner is? You probably don't. That means it's a private equity company that does not give a crap about you. You're gonna be old, gray, and miserable until you get the message, some of you guys. Some of you guys will never get out. You'll be gray, old, and your back is gonna be blown out. I mean, not that kind of way, you know what I'm saying? Like literally, like your back is gonna be out. You're gonna dislocate a disc. That was funny what I said. But you got dirty minds. You're gonna dislocate a disc. And you're gonna have grays coming out before you get it. That you're playing a rigged game. The only way you should play this game is going for the ultra wealthy clients. Let me play a little bit more of this video so we can.
It's toxic. It's toxic energy that's radiating. I just walked off. I just walked out of the hospital. I just walked out of the unit.
Yes, I don't blame you for walking out, because even outside of the owner, the private equity company, the patients are treated less than humans. They're like treated like cattle. The American healthcare system is a mess right now. It's a complete mess. And then on top of that, you add the government shutdowns and everything. Oh my goodness. And the big beautiful bill that is cutting spending for everything. They're trying to nickel and dime everything. And all these like patients are gonna feel it. They're gonna feel the poor quality service. Some of you clearly have never been to a third world country, have you? Or if you have been, if you're from a third world country, you probably forgot what it's like out there. It's crazy. The United States healthcare system is less than or is equivalent to a third world system. Here where I'm in this country where I'm at, they have better hospitals that will treat me better than I'm treated in the United States. And I'm in a third world country. And it's affordable because I pay out of pocket. That's how cheap it is. And meanwhile, if I get sick in America, like I'm screwed. I'm doomed. Do you blame the patients for feeling that way, for being cuckoo? No. Because the system is messed up.
I didn't tell anybody. I got floated, and they ran me down with way more patients than I'm supposed to take. And it's literally 12:52. I just walked off, and I'm just sitting in the car.
Yeah. She was floated more patients than she could handle. This is many of you. I spoke to a lady who was saying I was given 9 patients in a shift. That's nothing. I spoke to another lady that was given 11. And they're all crazy. The only way out of this is to reduce the amount of patients and going for the ultra wealthy, because the ultra wealthy have all the money. When people in the middle class are getting wiped out, when the poor is getting wiped out, there's only one group that's got the money. It's the ultra wealthy. That's where you should be going. If you're ready to get to the ultra wealthy, targeting them, making sure they pay you for the services you have to offer from your home care business. Schedule time. I put a link in the description of this video. I'll help you to brand your home care agency. Target your branding, your messaging to them, and then convince them to do business with you. So instead of you dealing with 9 patients like she's dealing with, you're only dealing with 1 or 2 tops, and they're paying you good money. Schedule time. You're sick and tired of being sick and tired. Or just be like her and many others just like her.